Wednesday afternoon with us. I'm Dr. Jun from Rick's Clinic.
Hello, I'm Dr. Melissa here. Thank you for spending your evening here with us. So we are so excited today to actually share with you a very important topic or a very important issue that actually troubles most of the women out there, which is actually melasma.
Yes.
So our topic today will be why your melasma keeps coming back. So we will dive into what is actually melasma, what actually causes the melasma, and why some people actually experience the rebounds after the melasma has actually come down to remission. So here we will actually dive into more onto hormones and your body inflammation. That is what most of the people out there are not aware of.
Yes, so stay with us until the end of the live, okay? And you can drop your comment or any question in the comment box anytime, and we will answer it at the end of the live session. And also, not to forget, today have something special that there's for live viewer only. There's something special for you guys, only 10 packs, and there will be a free blood stats interpretation. Okay, so you just need to bring your blood test that are recently done within these 6 months, or there is a 200 ringgit voucher for blood test done here. Yes, and also there will be 20% off of the DHEA for suitable candidates as well. So stay with us until the end of the live to know how to claim it.
Yes, okay, so that's actually not the main thing here today, but that's just a small gift for everyone out there who's interested or who are actually troubled with this melasma issues. So let's first start off with our topic today. So before we go into the the facts about melasma, let us start with some quick poll, and also we can actually help to dissolve two myths that actually what we hear every day, every week about melasma. So the first question is actually, have you ever treated melasma before and it returned? So have you had melasma before this, and have you treated it before and then it relapsed again? So if you have this issue, you may answer yes in the comment box, okay? So I'm sure a lot of people out there, they are actually having melasma issue, especially those after 40, or nowadays even after 35, we can actually see that the age of people having melasma is actually getting younger and younger, okay? So melasma not just affecting the elderly women, but some men as well, okay? So not just women, it's just that most of the patients out there with melasma are women. Okay, so men can actually have it too.
Yes, definitely. So yeah, there's something that many people ask, like whether is sunscreen alone and just wear sunscreen then is enough to protect us from getting melasma. Is that really so? What do you think about it? You can type M for myth or true, T for the truth. Yes, and also many people go for laser to treat their pigment. So is laser the correct way to treat every pigment? Yeah, is it enough just for melasma? Yeah, you can type your answer below.
Yeah, so I hope that after going through the whole topic with you guys, you can actually tell us the answers of these two questions at the end of the session of the live. Yes, okay? So before the solutions, we need to understand first what melasma really is. So what melasma really is, you may have a look on the slide. So melasma isn't just surface sunspot. Okay, surface sunspot are actually just freckles or lentigines, but melasma is actually more onto the deeper skin problem, but also signifying a deeper problem, that is the body inflammation. Of course, from the skin surface, we can see that it's just pigmentation increase, that is the production of the melanin, okay, by our skin pigment cells, melanocyte. So the excess pigment that is being deposited on our skin, okay, is actually seen as melasma. So it appears as patchy, okay, homogeneous patchy, okay, pigmentation over our cheek area. So some people actually also call it as like a butterfly shape, okay, so it can vary, okay. But most importantly, when we look at melasma, it can actually be of three types. So it can be of skin surface, the epidermal type, which from our naked eye we can actually see that the pigmentation are more obvious or darker in color. So that's the first one. And then the second one is the dermal. Dermal is actually the deeper layer of the skin, okay? And then the third one is actually the mixed type, which is actually a mixture of epidermal and the dermal, which is the most common type of all. Okay, so melasma is not just your skin surface problem. Here, when we look at it, it may just look like it's your skin problem, but when we go further or deeper into it, it's actually signifying your body inflammation that is actually increasing. It can be due to stress, your sleep, your diet, okay? All these actually play a role. So it's not just skin problem. So maybe Dr. Jane can tell us more on to what are the different types of pigmentation? Because when we say melasma, most people will say that, oh, I am having melasma, but maybe it's not. So how do we differentiate the different types of pigments?
So it's really important to differentiate between melasma and also other pigmentation on our skin because the treatment plan will be different as well. Okay, so there's a few pigment problem that looks alike melasma. Okay, so like freckles. Freckles is usually very tiny, dotty. Okay, and usually appear on younger skin. Okay, and also it become more obvious when it triggered by the sun. And yeah, with some laser, then it can fade it off very easily. Okay, and another one that looks like melasma is solar lentigine. Okay, solar lentigine is like round, more well-defined dark patches, not like melasma. Melasma is more irregular. You can't see the border really clearly. Okay, yes. Then another one is like post-inflammation marks, like maybe after your acne, okay, acne breakout, or like your eczema, then tends to leave some marks behind it that will slowly faded with time. So melasma is more like very blotchy, very irregular, and then the pigment color, some will look more obvious mixed with some more less obvious brownish color patches. Yeah, it looks more like dirty kind when you look at the person.
Or maybe I can say that if we want to differentiate all these three from melasma, the other three are actually just skin surface problem, but melasma is not that simple. That's why today we are going to actually digest more into melasma and your hormones. Okay, so melasma actually is not just skin problem, just like freckles, solar lentigines, or PIH, so which can be treated with just skin treatment. So melasma, we first have to understand what are the core relapse triggers that can actually trigger the relapse or return of the melasma after it has settled down. So first of all, the first trigger is actually UV or visible light exposure. So as we know, most of the pigmentation, no matter it's freckles or melasma or lentigine, UV ray is actually the core trigger. Okay, so here melasma can actually be triggered off again if exposure to UV light. Okay, and number two is actually barrier damage. Okay, barrier damage such as using very harsh chemicals such as over exfoliating, okay, hot steam sauna, which actually trigger off the melanocytes to become active again, producing more and more melanin. Okay. Yes. Okay. And number three is actually the wrong strategy pitfall, which is happening right now in the aesthetic or skin field, which is just chasing about pigmentation, but ignoring the inflammation that is actually the core trigger down there, or we say the root cause down there. Okay, so nowadays there's a trend saying that laser is the treatment for melasma. Okay, this is actually not true. Okay, so if we say that laser is the treatment, it can actually just temporarily lighten up the pigment, but the root cause will still be there. So any triggers such as this UV, barrier damage, or any strong laser can actually trigger off more inflammation and more obvious pigmentation or melasma relapse in the process of treatment. Okay, so by looking at these core triggers, we know that for UV exposure, we have to actually apply sunscreen. Okay, so sunscreen alone is actually not enough. So sunscreen, what are the mistake people out there are doing is actually first applying too little sunscreen. Okay, so the correct way of applying sunscreen is actually 2-finger breath. Okay, so this 2 length of sunscreen for just one part of the face. So imagine the amount of sunscreen you have to use to actually provide adequate protection for your face. Okay, and number 2 is the forgetting to reapply again. Okay, so actually sunscreen you have to reapply every 2 to 3 hours, especially if you are on an outdoor activities. Yes, okay. So number 1 is too little. Number 2 is less frequent. So it has to be reapplied every 2 to 3 hours. So of course, for barrier damage, have to avoid those over-exfoliating harsh chemicals. And wrong strategy pitfall, of course, we have to actually follow what the correct strategy from the doctor who has already classified whether your pigment is melasma or it's not melasma. The treatment strategy will be different totally. Yes.
So what is really causing the melasma? Okay, so it's not like sun exposure, things like that. Okay, so the main culprit is actually our hormones in the body. So especially it's like the estrogen. Okay, estrogen. When our body has a relatively higher estrogen level, okay, maybe due to our own production or maybe due to our body inflammation that causing our good protein, which called SHBG. Yeah, for those people who always listen to our live, will be very familiar to this term SHBG, sex hormone binding globulin. So it's a good protein that bind with our estrogen, testosterone, yeah, together. So when this SHBG is low, then it can cause relatively higher estrogen, free estrogen level in our body. So estrogen will, if the free estrogen level is at a relatively higher level, okay, it can cause overstimulation of our melanin, the pigment cell, yeah, causing more pigment on our skin. And also it can cause our blood vessel to be more active and tends to be easily inflamed. Yeah, when the inflammation is ongoing, then it can damage our collagen in under our skin, the barrier that between the outer and the inner layer. That's why when in melasma, because of the inflammation and also the barrier damage, then our pigment cell will tend to be at 2 layers, the outer layer and also the inner layer. Okay, yeah.
Or that means simple to say estrogen is actually not the culprit, it's the imbalance.
It's
the imbalance, the hormone imbalance.
Hormone imbalance.
Okay, so having estrogen is actually fine. It's
Yes.
just that when the estrogen activity predominate
Progesterone.
Okay,
Yes.
okay.
Yeah, and also because of body inflammation that causes relatively higher free estrogen. Yes. Okay. So and also other hormones that can influence, okay, causing melasma is like when we are in stress. When we are in stress, if we are in chronic stress, then our body will have higher cortisol, the stress hormone, and this one can also cause our skin barrier to be weakened and tends to be more inflamed, and also at the same time it can cause drop in SHBG as well. Yes, and another hormone is the insulin. So this is especially seen in those people with which has insulin resistant issue like obesity, diabetes, PCOS. Yeah, this group of people also have risk in developing melasma as well. Yeah, another hormone, important hormone is the thyroid. Yeah, thyroid. When we have suboptimal thyroid, maybe a lower thyroid level, then this one can also lower the SHBG and worsen the estrogen dominance pattern. Yes, and also it can also influence the repair, our skin repairing process as well. So actually, all these things at the end it still come to the SHBG level, and because of the low SHBG level and causing this relatively high estrogen and cause melasma. Yes.
So there are actually quite a few hormones that interact with the melasma, okay, such as the estrogen, progesterone, insulin, thyroid, but the main one is still SHBG that's controlling all. Okay, understand. Okay, so maybe next we move on to what are the 4 pillars framework that actually help to prevent the relapse of melasma. Okay, so first of all, the pillar number 1 will be protection. Okay, so just like what I've mentioned just now, how to protect our skin from UV light is basically sunscreen. Okay, sunscreen is actually your basic skincare. Okay, so don't forget your sunscreen every day. And first of all, how to choose a good sunscreen if you are having pigmentation problem. First, the SPF. Look for the SPF 50 plus. Okay, broad spectrum. And number 2 is actually you have to choose a tinted sunscreen, preferably those with iron oxide inside, because that actually help to protect your skin from visible light. Okay, so that's the first one, how to choose a sunscreen, and number 2, how to apply. So how to apply is number 2, that is to apply using the 2 finger length sunscreen. Okay, the amount should be enough to cover the whole face. And number 3, you have to reapply every 2 to 3 hours to protect your skin from the sunlight. And lastly, besides sunscreen, okay, you can use physical protection such as hat or sunglasses or shades to actually protect your skin from the UV light. Okay, that's number 1, how to protect your skin from the sun.
Yes. And then the second important step is you need to calm down your skin. As we said earlier on, melasma is not just pigmentation, it's also skin inflammation, body inflammation. Okay, so other than protect, another important step that you need to do is to calm down your skin. Do not damage your skin. So
no harsh chemicals.
Yes, no harsh chemical, and also use gentle product. Yeah, with preferably with pH level of 5 to 6 because that fits our skin pH. Okay, yes, and also you can use some hydrated moisturizing skincare, which consists of like ceramide, cholesterol. Okay, and then there's some ingredients in the skincare that is can help to calm the skin, to calm down the inflammation. It's like tranexamic acid or niacinamide as well. Yeah, and also tranexamic acid is also available in oral form. And yes, if after assessment by doctor, if you are suitable and your melasma is very hard to treat, then you can consider oral tranexamic as well.
Yes, so talking about this pillar 2, actually I want to share that most patients with melasma, they have actually drier skin.
Yes.
That's why moisturizer with ceramides are actually suitable for them because they have dry skin.
Yes.
Okay, so avoid harsh products that can actually trigger off melasma even more. So next we move on to number 3, that is regulate the melanogenesis. Melanogenesis is the process of making melanin pigment. That is the pigmentation that causes melasma. Okay, so besides niacinamide, tranexamic acid that can be found in skincare that can help to regulate melanogenesis, there are a few actives such as azelaic acid, okay, cysteamine, okay, vitamin C, okay, as well as retinoids, okay, and kojic acid can also help to actually calm down or we say slow down the process of melanogenesis, okay? However, do note that some of these ingredients such as cysteamine and also such as retinoids, okay, it can actually cause some dryness or skin stinging, redness. So do adjust the frequency of using them if you experience this, and also you have to use it under the guidance of a doctor. Yes, okay?
So number 4. So after we have done all the steps, okay, it's also very important to maintain it. Okay, yes, maintain it for a long-term better result. Do not just stop everything after your pigment is settled down. Yeah, and also give it some time to see the improvement in the result. Yes.
So I think this is what most of the patients often neglect because once they see results, they stop everything.
Yes.
They stop thinking about maintenance.
Mm.
So maintenance is actually the longer, how we say, the longer journey that we want patient to focus more on instead of just seeing temporary improvement. Because maintenance can actually maintain or give the results last longer. Okay, so can give a better satisfaction to our customers as well.
Yes.
Okay, so next we move on to managing the drivers of melasma. Okay,
Yeah. So just now what we were talking about is more on like what you can do
at
by
home.
yourself,
By
at
yourself,
home.
yes.
Yeah. So and earlier on also we have talked about like hormone influence on melasma. So other than all the 4 pillars in front that we talk about, it's very very important also to tackle the underlying causes of the melasma, which is the hormone. Okay, so the first one, yes, so it will be the sex hormone balance. Okay, progesterone and estrogen. These 2 hormones is pairing together to when it's in balance, then our body will be in harmony. So if let's say our body have relatively estrogen dominance patterns, okay,
What are the signs of estrogen dominance pattern?
yeah, then you can see that maybe during menses, we tend to have like breast enlargement, breast tenderness, or like menstrual cramping. Maybe you will feel like mood swing as well.
Very agitated.
Agitated.
Okay.
Yeah.
Yes.
Yes. So if let's say when we assess you, we find that yeah, your symptoms is very much related to estrogen dominance status, then we will be considering supplement hormonal supplement, well identical hormonal supplement, progesterone to balance.
To balance out the imbalance that has actually triggered off your melasma.
Yes.
Yes.
And then the second one, just now we talked about insulin resistance. Okay, so insulin resistance is what is called insulin resistance is when our body is producing more insulin because of our cell cannot respond to the insulin efficiently. Okay, and convert it into energy. So how to tackle it is we first need to know what is the causes of insulin resistance first. Yeah, the first one is like obesity, like maybe physical inactivity, PCOS, yes, and also maybe the unhealthy diet, okay, such as frequently taking processed food, high sugary food. Yeah, all these things can cause insulin resistance. Yeah, so we need to tackle it one by one as well if you have any of these causes. Okay, so first, if you need to weight loss, especially if you have high visceral fat, this will contribute to insulin resistance.
So how to lose weight?
Yeah, lose weight you can first by diet, okay, physical activity, okay. Yeah, if let's say these two never work, then you can considering seeking medical treatment. Okay, yes, and yes, other thing is eating healthy balanced diet
So
as
more
well.
protein,
More
more
protein,
fiber.
more fibers. Okay, less carbohydrate, less refined
Sugar.
carbohydrate. Yes, okay, and also be active. Okay, regularly exercise. Okay, if let's say these three things is not working efficiently, then you can consider medication such as metformin. Yes, this can help with your insulin sensitivity.
Thyroid supplement actually also help with insulin resistance. Okay, so thyroid supplement not just helping with insulin resistance, it can also improve our body metabolism, thus improving our energy level, as well as raise our SHBG, which is the core hormone that's controlling our body inflammation. Okay, so thyroid hormone supplementation is actually an essential part in melasma treatment as well, besides progesterone. Okay, so the next one will be actually stress and sleep. So most of us know that stress or lack of sleep actually can also trigger off melasma because it's related to our body inflammation. Okay, so because when we are stressed or when we are lacking of sleep, our DHEA hormone actually go down. Okay, so what are the ways that we can help to reduce this irritation? Is actually through enough sleep, okay, 7 to 8 hours of sleep, and then cool down skin habits, limit late night activities, especially after 10 or more screen time, yoga, meditation, slow walks, and also if you are still having sleep issues, you can actually consider supplementation such as magnesium glycinate or even melatonin hormone, which is our natural hormone in our body at night, under guidance of the doctor to help you to improve your sleep. Okay, because by improving your sleep, you are not just improving your quality of life, you are actually also making your skin healthier. And lastly is about DHEA hormone. Okay, so DHEA hormone, as what I mentioned just now, is also a stress hormone. Okay, so by balancing our body's stress hormone, it actually allows more progesterone production, thus reducing our estrogen dominance and improving our skin quality, as well as improving the melasma. Okay, so DHEA is also an important hormone in melasma besides progesterone, estrogen, thyroid, insulin, okay, SHBG as well. It's the protein that's actually governing all. Yes. So after understanding all the hormones, maybe we can move on to what are the steps, the procedure, the safe steps that we can take.
Yeah. So just now earlier on we have asked about like is laser the cure for melasma? Yeah, it's not totally true or totally wrong. It still be a part of the melasma treatment, but we need to plan when to do it. Have to do it at the right timing. Okay, so before we go for any laser treatment, okay, we need to make sure our melasma skin has already calmed down. The inflammation has already calmed down. Then only we will introduce the laser procedure such as pico laser, okay, that help with the pigmentation and also like RF microneedling, which help with the skin texture and also pigmentation as well. Okay, and another thing, there is a laser that especially targeting into the vascular component of melasma is the yellow laser, dual yellow laser. So by combining this treatment at the right timing can give a good result in treating melasma.
So that's what actually we are doing here, which is by stabilizing our skin first, or we say reducing the inflammation first. Then only most of the people out there, they will just proceed to the laser straight away without managing or stabilizing the skin first. So stabilizing the skin first is actually very important because it prepares your skin for the harsh treatment such as the strong laser. Okay, so stabilizing your skin, you can actually do yellow light treatment, okay, and picotoning, or even the RF microneedling to actually calm down the inflammation first before going to the next step. Okay. Step number 2 is actually we try to avoid too frequent and too strong laser. Okay, because melasma is actually not just your skin problem, it's actually your body inflammation problem as well. Okay, so avoid strong laser and too frequent laser, because I've heard actually patients doing laser every week, which is actually bring more harm to your skin rather than benefits. Okay, so laser for melasma is actually quite tricky because not all patients are suitable for laser. Okay, not all melasma patients are suitable for laser. So bear this in mind that you have to actually consult a doctor first before deciding whether your skin is suitable for laser or not. Okay, and just now we mentioned that not too strong and not too frequent because it can actually cause rebounds. Okay, and the next one is actually it has to be combined. So we have talked about skin treatment. We have also covered hormones treatment. Okay, so both has to come hand in hand if you want a lasting result. Because by just doing one side only, you might see results temporary, but it will rebound very fast. Okay, so what's important is actually what Dr. Ju mentioned, how to stabilize, how to maintain the results. Okay, by combining both. That means the outer and the inner treatment. Yes. Okay.
So yeah, so back to our question at the beginning of our life. Yeah, just now, yeah, we have asked: is sunscreen alone is enough for preventing treating melasma? Yeah, so I think now everyone will know the answer. Yeah, sunscreen is very important, but it's just part of the important step. Yeah, we still need to combine the treatment by treating from innerly, treating the causes, okay, and to maintain the result. And the second
one is actually one strong laser cures melasma. Okay, so this is actually not true. Okay, so what I've mentioned just now, melasma is not just your skin problem, it's more to your body inflammation problem as well. So one strong laser will not cure, it will actually make your melasma worse. Okay, so don't go for strong laser. Okay, because aggressive heat can actually cause more backfire to your melasma. That means worsening of your melasma. So make sure you do under guidance of a professional doctor. Okay.
Lastly is do not stop once your pigment or melasma is cured. You still need to maintain all the steps to prevent the relapse. Yes.
Okay, so make it a habit to wear sunscreen. Okay, SPF 50 plus, tinted sunscreen with iron oxides, and then ceramide moisturizer with actives such as vitamin C. Okay, cysteamine is fine, retinoids is fine. Okay, and also make sure to avoid harsh chemicals and also take care of your stress, your sleep, because all these actually play a role in it. And if the problem still persists, then consult a doctor for better treatment plans. Okay.
So yeah, so now we can move on to our Q&A section. Let's see. Okay. There's some question from the Instagram. So the first one is H2Cat. He asking chemical sunscreen versus barrier sunscreen. Which one is better? Any benefit in taking oral sunblock? Yes. So yeah, chemical sunscreen and barrier sunscreen. Barrier sunscreen basically is the physical sunscreen, which consists of the tinted iron oxide. Yes. So the difference is chemical sunscreen, it can absorb the UV ray, okay, and barrier sunscreen, it reflects the UV ray. So these two has their own benefit, okay. For those people with regularly or maybe frequently exposed to like digital screen, okay, and also having some sensitive skin, oily skin, okay, it's preferably to use physical sunscreen as this can give more protection to them. Any benefit in taking oral sunblock? Yes. So oral sunblock basically contains some antioxidant inside. So the oral sunblock can protect us. There's some protection from the oral sunblock by protecting us from the UV ray, okay, by their antioxidant effect. It's suitable for those people that always have outdoor activity. It gives extra protection on top of the physical chemical sunscreen. Yes.
Okay. So yes, so about the questions of Miss Soling, if we consume HelioCare, do we still need to reapply sunblock every 2 to 3 hours? The answer is actually yes, okay, because as what Dr. Jun mentioned, HelioCare, or we say the oral sunblock, is actually additional protection from the sun, okay? So it cannot replace our physical sunblock. It's just an additional protection. So physical sunblock, you still have to choose SPF 50 plus, tinted one, and also reapply every 2 to 3 hours if you are still taking the oral sunblock, okay? So don't ever think that the oral sunblock can replace the physical sunblock. Yeah, because both works differently.
Yes. Okay, so there's some questions from Facebook as well. Sherwin Chong asks, does sunscreen have to apply how many times a day, and any skincare alone can lessen pigmentation? Okay, so sunscreen, if let's say you are outdoor, okay, it is advisable to reapply every 3 to 4 hours. If let's say, especially if you are doing outdoor activity that making you sweating, or maybe after you swimming, yeah, this thing tends to take takes away all the sunscreen on your skin. So if let's say you frequently sweating or you are outdoor, then you need to reapply it more frequently, like every 2 hours, or maybe after profuse sweating, then after you have dried out your skin, then you need to reapply it immediately. Okay, and any skincare alone can lighten pigmentation. Okay, so this one will also depends on what type of pigmentation that you are having. If let's say like you're just having like lentigine, yeah, so maybe skincare alone can help to lighten it. But if melasma, because it's involve both skin and also the inner hormone, inner body health. So if skincare alone will just do very little job by lightening the pigment on your skin.
So the next question by Miss Sen, is there any difference between oral sunblock and topical sunblock? Okay, so just like what we have mentioned, the example of oral sunblock is actually like Helio Care, just like what the other two um, our patients mentioned, and topical sunblock is actually your sunscreen. Okay, so the difference between them, one is actually you consume it orally, and one is you apply it over your skin, your face, your neck. Okay, and then the difference between these two. Okay, so physical or topical sunblock is a must. Okay, and oral sunblock is actually an additional. So if you have extra time, you can actually consume oral sunblock for extra protection. Okay, and of course both works differently as well. One is actually protection physically from the sun, the other actually more onto antioxidant. It helps in skin lightening and additional protection from the sun so that you won't get tan so easily. Because I've actually patients who went overseas in tropical country, they took both, okay, oral sunblock and topical sunblock. So they realized that actually by taking both, they actually don't get tan so easily. Okay, so additional protection for sun protection if you are going to those tropical country with a lot of outdoor activities such as surfing, diving. Okay. So any more questions from the floor?
So I think for now, that's all the question that we have from from our viewer. Yeah. So just to summarize again, some key takeaway for treating melasma, okay, is you need to stabilize first. Okay, do not go for laser straight. I want to do laser. Okay, you need to know your skin first. How inflamed is your skin? Okay, whether is it truly just a normal pigment or melasma? Okay, if it's melasma, then you need to stabilize first and protect your skin with sunscreen. Okay, and also calm down your skin. Okay, by either applying some skincare that help to calm down and lighten your skin pigmentation, or taking some oral medication to calm down the inflammation. Okay, and yeah, use some smart active ingredient that beneficial to the skin pigmentation, like tranexamic acid, and another one is the cysteamine. Okay, and also very important is need to know what is the cause. Okay, what is the triggers of the melasma? That's the most important thing we need to tackle and treat the causes. Okay, and after you have stabilized, calm down your skin, then you can go for the for the procedure. Okay,
Gentle.
gentle procedure. Okay, and also when after you have see the result, do not just totally stop everything. Okay, you still need to maintain all the things, all the steps to get the long-term successful result.
Okay, so now we have actually a live only offer, which is actually you may type M, okay, in the comment box below. Then you are entitled to a free blood test interpretation at our Refix clinic, okay? Because actually, why do we put blood test as the first? Because as what we have mentioned, body inflammation hormones are actually the triggers or the root cause of melasma. Okay, so by doing a blood test, including the inflammation markers and then the hormones, we can actually know the level of your body inflammation and your hormones level. Is it weak? Is it optimal? Okay, is it normal? Then we can, from there, we can optimize it, okay, to help to improve your melasma. Okay, so blood test is actually very important in melasma. So yeah, you may type M in the comment box below to entitle for this free blood test interpretation. But remember, bring a report less than 6 months old, because if more than 6 months, then it's not so accurate anymore. Okay.
And for those that maybe you guys don't have any recent blood test result, you are welcome to come and get free consultation from us as well. And yeah, by typing N, yeah, you can claim
This
for
200.
this 200 voucher off for the blood test done in our clinic. And also there will be a free one-time hyperthermia trial as well.
So what's hyperthermia?
So hyperthermia is actually devices, okay, machine, okay, that you just need to lie on it, okay, very comfortable, and yeah, it will raise your core body temperature up to at least 38 degrees Celsius.
So how does it help me with my melasma?
Yeah, so this one by increasing our core body temperature, and it can activate our body immune cell, and also can help to improve our blood circulation, okay, and by then it can help to improve our body inflammation and balance out our hormone as well. So this can help in melasma.
See.
Yeah, so there will be additional 20% off the HEA for suitable candidates after our assessment. Yes. So you can type N in the comment box if you have any friends or yourself having melasma and is struggling treating your melasma. So you can type M in the comment box to claim this live only today, only for 10 people.
Yeah,
Yes.
for 10 packs. Okay, so talking about hyperthermia, I've actually a case to share. So we have actually a patient who is here actually for hyperthermia treatment, but not for pigmentation. So she's here actually because she's a cancer patient, okay, undergoing chemo and radio. So she's doing hyperthermia at our center to actually strengthen the medical treatment that she's undergoing, okay. So, but at the same time, she's having some melasma problem, but she is not concerned about it at the moment, because her focus is just on her cancer. So actually, after doing so many sessions, I think she has done more than 20 sessions of hyperthermia. She actually told us that she realized her pigmentation over the face actually faded off or reduced after this hyperthermia treatment without doing any topical treatment or laser. So she's just doing hyperthermia solely for her cancer treatment. Yes. So it's actually a very, a very advanced technology. Besides the topical treatment, laser treatment, and also the hormonal treatment to help in melasma treatment breakthrough. Yes.
You can see here there's few live viewer responding to us, sharing patient sampling. Yeah. Okay. Miss Sun, I've done a blood test last month. Can it be used? Yes. Yeah. The blood test which just done last month, definitely, yeah, you can bring it to us, then we can help you to interpret. If your blood test have test the hormones, yeah,
It's even better.
It's even better.
Yes.
Yes.
Not just hormones, so inflammation
Yeah,
markers.
inflammation marker,
Okay.
vitamins.
And I saw another question.
Oh, how to check.
Okay, so Miss San also asked about just now mentioned about hormone. How do we check? Okay, so here we actually will withdraw blood, okay, for the hormone test, and you don't really have to fast just like other routine medical check that you have to fast. This one, no, you can just come anytime. Okay, then we will withdraw blood around 8 cc of blood to send for all the hormone tests, inflammation tests. Okay.
What type of blood test? Yeah, so basically is the basic blood test like full blood count, liver function, kidney function, and additionally is the inflammatory markers. Okay, this one is important also to look into your overall body inflammation status, whether is it you are having some long chronic slow body inflammation, and also hormones which include like thyroid, estrogen, progesterone. Okay, even better if you have the cortisol. Okay, and also vitamins. Okay, vitamin D, vitamin B, iron. Okay, yeah.
Yeah, so do I need to do fasting? So just now I mentioned no need to do fasting. So what's the difference of your blood test and others?
Yes. So the blood test, the blood test is the the one I mentioned earlier on, and also we will interpret it, okay, by seeing your optimal body hormone level. Yeah.
Okay, so maybe I can add on for the blood test. Actually, from our point of view, we are not actually diagnosing whether you are diseased or not, just like what other doctors, they do the blood test to see whether you are having diabetes, hypertension, or any other heart diseases. Okay, so our part here is actually looking more to your functional side of your body as well as your hormones. Okay, so that's why no need for fasting. Okay, so the blood test here is mainly for your overall health, and by looking at whether your hormones are optimum or not, and need to optimize or not. Okay, and the body inflammation part, whether we have, what are the ways that we can do to actually bring down the body inflammation by actually looking deeper into your blood test. So not just the surface of diagnosing whether you're having high cholesterol or high blood pressure or diabetes. Yeah, like that.
Yes. Any more questions? Okay, so yes, so if you're having melasma or your friends or family member is having melasma, so you can, always bring her or yourself to our clinic, okay, to get a detailed assessment and consultation. Then we will guide you through on what is suitable for you, okay.
So if you're ready for a tailored or a customized plan that actually integrate your hormones, topicals, and also device sequencing, book a consult with us at Revix Clinic Eco Sanctuary today, and you may also type melasma, okay, to get the live only promo. Okay.
Remember to type N
Yes.
in the comment box. Okay, so
So our next live will be on another 2 weeks, okay, on the 3rd of December, Wednesday, same time at 5 p.m. So it will be a brand new topic again on the tired eyes, yes, rejuvenation. Okay, as Christmas is approaching, Chinese New Year is approaching soon, more people are actually doing preparation for it. Okay, so if you're having tired eyes or dark eye circles, do stay tuned for our next live.
yes, so remember to join us on 3rd of December, okay. So
you for your time today. Have a good evening.
Okay, see you again.
See you.